Hi, my name is Claire Biermaas, and I lead our customer experience and insights team at AmerisourceBergen. My team uses a design thinking approach to understand our customers, and we use that insight in order to inform our business about how to make incremental improvements to our service experience, but also inspire large strategic and creative change and innovation at AmerisourceBergen. At AmerisourceBergen, we work really hard to empathize with our customers. The attitude and the mindset that we take when approaching our customers and our customer experience is one of empathy. It's really important to do that in the design thinking process because you're putting yourself in the shoes of your customer. We work with our customers to really understand who they are as people so that we know and learn how our distribution experience works for them or does not work for them, and why. It's the answers to the why that's really, really important. We use those insights to create ideas at AmerisourceBergen, right? So we run workshops and we use that basic understanding and that empathy for our customers, and we provide that information to our business leaders and the teams that they lead so that they can generate ideas on how we can be better. And when I mean better, I mean not just the incremental changes, like the improvements that are right in front of you, like the things that are pretty obvious that you need to improve, but also insights that inspire creativity within our business leaders and their organizations so that we can come up with ideas that help to differentiate AmerisourceBergen, but really help to be a better and easier business to do business with. We know that if we're hard to do business with, that can impact our customers' ability to care for their patients. Being patient-minded is really important at AmerisourceBergen. We align ourselves with our purpose of creating healthier futures. And what that really means is that you're developing products and services and experiences for your customers that help them take care of their patients. And knowing that we can either help that process or hurt that process is really important mindset and an attitude for associates at AmerisourceBergen to have. So we do our best at ABC to make sure that we're understanding our customers and what they value and how they're taking care of their patients every day. We use that as inspiration and motivation for our customers and our associates on a daily basis. I think that innovation comes in many shapes and sizes. We use our customer experience strategy to really define that near-term innovation. So the things that we hear from our customers about how we can improve that core distribution experience, from what it's like to order to what it's like to receive product, and if something goes wrong in those two processes, what is it like when you're trying to handle exceptions? And that's their day-to-day experience, that's their daily experience. But one of the things that we have come to understand at ABC is that you can make really incredible and innovative improvements at the core of who you are. It doesn't have to be entirely market disruptive. And I'll give you an example of that. The improvements that we've made to the design of our ordering system is really, really important first step to proving to our customers that we're listening to who they are and we're innovating on their behalf. So our ordering platform is not just going to be a place that you can order your drugs from. It is going to be a place where you can get your data and your analytics that will help you make really good decisions as a business leader. But it's not just the data, it's the way that we're presenting it in the platform is your ability to gain insights from that data and using that for you to make your business better. It improves your workflow. You can answer questions about like the costs associated with your drug spend, things of that nature. And we are designing that in a really easy way. And to us and to our customers that we've tested it with, it is a really innovative platform. We use a lot of our customer empathy and our understanding of who they are and what they're strategically trying to accomplish to bucket different areas of innovation, especially for our health systems customers. We know that there's a future of health systems pharmacy that is really supply chain focused. So being able to follow that pill throughout all the four walls of the hospital and outside of the hospital. We know that there's lots of things coming in the market and happening with patients that are going to influence pharmacy's ability to impact clinical outcomes. And we at AmerisourceBergen have a role in that. And we also know that the expansion of pharmacy services are really important to our health systems pharmacy customers. They not only want to take care of the patient within the four walls of the pharmacy, they want to be able to follow that patient in their entire ecosystem of care. So these are things that we know are really important to health systems. And AmerisourceBergen is investing a lot of time and energy into not just understanding that, but being really creative about the products and the services that we provide to our customers so that they can accomplish those strategic goals. I believe that the first step that health systems can take in order to prepare for the future is to really double down on their patient insights. We know that there's a big difference between someone who is generally healthy and someone who is chronically ill. And we tend to use the word patient to lump everybody together. And I really believe that it's important for health systems to really get underneath the difference between someone who is dealing with an acute illness, who is generally healthy and is interested in a health and wellness routine, and someone who is managing a chronic disease. That patient that's managing that chronic disease is dealing in an ecosystem of different pieces and parts and caregivers and communication channels and care plans, and they're trying to navigate a system in order to stay alive and to live somewhat of a quality of life. Where on the other hand, you might have somebody who's generally healthy, who's really interested in yoga and fish oil. The way that that person views the world and what's important to them is going to be a little bit different. And so the way that you treat them and the things that you talk to them about and the care plans associated with that person is going to look really, really different than someone who you're treating that has to deal with lots of different care providers in a system of care that has lots of different specialists that are talking to and treating that patient. So what I really mean by that is we talk a lot about EHRs and technology being able to connect people's care plans into one care plan. But you don't always have the different providers talking to one another. So if you are someone who has a chronic disease, you are waking up every single day trying to manage that chronic disease. It is what you think about on a consistent basis, and you're dealing with all sorts of different specialists in your system of care. It's those insights and that empathy for patients that are really going to drive the different products and the services associated with those health system strategic goals. So understanding the context by which they live, their social economic situation, what they care about, where they are on the spectrum of health and wellness, all of these things are really, really important to the future of care within a health system because those patients are the ones that are either going to choose you or they're not going to choose you. And they're gonna take those surveys that you're getting measured on as far as the patient experience is concerned. So it's just really, really important for health systems to double down on an understanding of who patients are and their health and wellness journey and how that health system fits into that patient's world or does not.
Hello, my name is Alex Minkoff. I am Vice President for Customer Strategy at AmerisourceBergen. I have responsibility for listening to our customers and what they need from a products, services, and customer service perspective, and bringing that back to AmerisourceBergen to ensure that we're delivering on our promises to our customers. The challenges that health systems and physician practices face today with specialty products really comes down to two things, and that's access and cost. And what I like to tell customers from the cost perspective is that when specialty pharmaceutical products are nearly half and increasing of all pharmacy spend, then specialty pharmacy really is pharmacy. It is the most critical aspect of pharmacy today for health systems and physician practices. When it comes to access, AmerisourceBergen is the leader in providing access to specialty pharmacy products for health systems and physician practices. In the physician practice space, we have market-leading distribution arms that reach deep into physician practices for access to all types of specialty products, as well as GPO services to ensure that our customers are getting the best price possible in the market in outpatient infusion and physician practices as well. And for limited distribution, oncology and rare and orphan products, we also have US Bioservices, which provides access to those products as well as full wrap services for specialty products as well. Data is critically important to our health systems customers, and in fact what they say is we need help turning data into actionable insights in order to enable better decision making in patient care, in supply chain efficiency, anywhere that pharmacy has touch or reach, they need help with those insights. One way that AmerisourceBergen is partnering with customers today from a data perspective is in cost forecasting. This enables our customers to look across the health system to be able to determine what the impact will be if there is a spike in price, if there is an increase in a certain patient population, any major contract changes. They will be able to be better prepared for those changes should they occur. Another way we are partnering with health systems today is by giving them access to industry-leading transitional care services. Health systems need a way to identify the patients that are most susceptible to readmission to the hospital. At AmerisourceBergen, we are providing our customers with access to industry-leading transitional care services to help the health system identify the patients that are most susceptible to readmission, ensuring that their handoffs between care settings and departments is smooth, and to ensure that they're taking their medications and the right medications to ensure that they're not readmitted to the hospital. We are also working with our health systems customers to aggregate outcomes data to bring back to manufacturers to ensure that our health systems customers have access to specialty products, and to also bring our manufacturer partners deeper into the health system to better understand the needs of health system pharmacy.
I'm Matt Wolf. I'm Group Vice President with Pharmacy Healthcare Solutions. We're the healthcare or health system consulting firm of AmerisourceBergen, and I'm a pharmacist by trade. So health system pharmacy is changing pretty dynamically, as is healthcare in general. Traditionally, health system pharmacy has been very focused on inpatient pharmacy. With the immersion of different payment reform and payment models, a lot of the activity is now moving from the inpatient element of the health system to the outpatient element of the health system. And that's really caused a paradigm shift for health system pharmacists to think out of the box or change their model from really looking at or seeking different avenues such as specialty pharmacy and ambulatory pharmacy, which in this case, those can be revenue generators for the hospital, rather than simply being a cost center and trying to find cost savings opportunities within the inpatient DRG-based system. So today's healthcare environment is ever changing. You see a lot of consolidation of health systems, and this is driving mostly through what I would call inorganic change rather than organic growth. And what I mean by that, it's through mergers and acquisition. So health system A is acquiring health system B, and health system A and health system B may have completely disparate systems, process, policies, and even resources. This creates an opportunity for pharmacy to generate something what I would call pharmacy systemness. It's an overarching methodology or approach to starting small to generate thoughts and ideas around how you can ultimately create and invoke a pure consolidated pharmacy enterprise. And it starts small, so it may be looking at areas such as pharmacy contracting, pharmacy contract compliance, pharmacy procurement cycle, things that are going to create kind of that atmosphere, if you will, of generating one pharmacy. And then downstream, you can start to look at other areas of opportunities such as formulary design, which are much more process oriented and take a lot more time to not only think through, demonstrate, but also implement. So PHS prides itself in that we're really pharmacy-centric. Many of us have sat in the same chair as the director of pharmacy or the VP of pharmacy prior to us becoming pharmacy consultants. So we understand the challenges that they go through in order to effectively demonstrate value as the practice of pharmacy up through the C-suite. So we've really developed consulting portfolios around key areas where we feel we can elevate the practice of pharmacy within an organization. Those areas may include specialty pharmacy, ambulatory pharmacy, transitional care services, centralization and consolidation, and 340B services. Those are all services or areas where we feel there's an effective ROI or return on investment for a hospital, where if we can effectively equip a director of pharmacy with a business plan or an ROI analysis, he or she can take that to demonstrate the value of pharmacy. Then from that, help them implement a successful program so ultimately they have a seat at the table at the C-suite level to show their value and show their proof point.